Did you know that Breast Cancer Awareness Month started on Thursday 1st October and ends on Saturday 31st this month? Mater Misericordia Hospital and the Sisters of Mercy have organized a free breast and cervical cancer screening on 18th October 2020 at the Well Karen first floor starting from 8 a.m. to 3 p.m. For more information, contact us on 0722 318 149 or visit our website www.materkenya.com. Breast Cancer Awareness Month. Mater Misericordia Hospital cares. But we're going to continue and we're talking about what are the risk factors for cancer formation. Maybe Dr. Wanjohi, you can take it from there.
So, remember what we said before our technical interruption is that the cancer is being formed anytime in the body, but then the body itself is able to cure itself. But for some people, it will persist. So now, it means they have some risk factors which put them at a risk of getting the cancer. So first and foremost, we can say age. There are some which are non-modifiable. There are some, the older somebody becomes, the higher risk of, yes. Secondly, is immune deficiency. So for somebody who has low immunity, for example, there are some diseases where the immune system goes down. So when that happens, then you find that cancer can easily come about. Another modifiable risk factor is such as diabetes. So some people, it's good, very good for somebody to know whether they have issues such as diabetes, to know their immune status in their body, because that way they can be more aggressive in taking care of themselves.
Okay.
Another one,
obesity. Interrupt on that, please. Because you have mentioned about diabetic. People say diabetic, it's an inheritance thing.
Yes.
So is it the same case with the cancer?
Okay, so some cancers can be spread genetically. So you find one family, they have a family history of cancer. So that is something also very important because that is non-modifiable. For example, breast cancer, ovarian cancer, and even colon cancer, those ones are going to spread through the family. So it's so important for someone to go and ask from their history, do we have a history of cancer in our family? And if so, which one, and how can I prevent myself? Okay,
maybe we can move into cervical cancer.
Yes.
Maybe you can explain to us what a cervical cancer it is, and maybe how common the cervical cancer we find it.
So now, it's very important for the viewer to know that this month of October, we are seeing about 3 cancers so much. For ladies, breast, cervical, and for men, prostate cancer. So why these 3 cancers? Why not cancers of anywhere else in the body? One is because for cervical and breast cancer, those are the common cancers affecting women in the world and even in Kenya today. Cervical cancer is the leading cause of cancer diagnosis and deaths in Kenya. And followed by that by breast cancer. Okay. Now, what is cervical cancer? It is now that cancer cell or that abnormality of the body, the growth happening on the cervix. What is the cervix? The cervix is the doorway into the uterus. Now, when maybe our viewers maybe can relate that when somebody is pregnant, they are going to carry the pregnancy until the baby is due. When the baby is due, the baby is going to, maybe for a natural delivery, the baby will come through a natural process. Now, the one that stops the baby being delivered before the 9 months are over is the cervix. So it has a very important function. Now, that area can get cancer developing, and this cancer, the good thing, it's easy to detect, and we can be able to treat even before the cancer begins to affect the body.
Okay, so it might be dangerous.
Yes, it is very dangerous.
And maybe you can explain how maybe this cancer is spread.
Okay, so it's important for the viewer to learn that among the risk factors, I didn't mention about diseases, so and toxins. So maybe toxins, we can say radiation. So if somebody works maybe in a nuclear environment, then they can get, or a place with a lot of X-ray radiation, then they can get. But for cancer of the cervix, it is spread using a virus, which is called human papilloma virus. So it is very common in the community that so many people have this human papilloma virus. Now, a few are the ones who are going to develop the cancer. So we are emphasizing for anybody above, between the ages of 21 and 65, for anybody with any risk factor, such as what I've mentioned, then they should go for screening for cancer of the cervix.
Okay, but most of the times, like you say, the women aged from 30 years and above are the ones highly affected. Then why from 21 then to 65?
Yes, because we find that majority of cases of cancer of the cervix will affect young women. They will not affect the old, maybe shoshos in the village. They are going to affect the young women who have just started a family, who have just started their career. Now they are suffering from cancer, and then they are going to die. So we want to, this productive part of the community, to be able to be there for the community, because we need them.
Okay.
Yes.
And maybe you can tell us what are the risk factors for cancer of the cervix?
So we said cancer of the cervix is spread through a virus, maybe in 99% of the cases. So how is this virus spread? It is spread as a sexually transmitted infection. So it can be spread through body fluids. Maybe just think about it like maybe the way HIV can be spread. So it can be spread through body fluids also, but mostly it will be through somebody engaging. So somebody with a family is at risk, a lady. So all ladies be aware that this cancer is real.
Okay, and what is the benefit of screening for cancer of the cervix? Yet some ladies, they say it's very painful and uncomfortable because there is a myth that says as a virgin, you're not supposed to go to have a cervix screening. Is it true? Because maybe some say you might lose your virginity. What do you think about it? Maybe you can say.
So that is very true, that somebody who has not begun their family should not necessarily go for screening. It is not necessary, because remember, this thing is coming through a viral spread. So it's going to spread to somebody. So somebody who is between the ages of 21 and 65, they say it is painful, but it is not painful. And you'd rather 5 minutes of pain when we are doing the screening, maybe 5 minutes of being embarrassed because we are doing the screening, then maybe 5 years of pain, of embarrassment, of going for theater, going for radiotherapy, chemotherapy. You see, someone should be able to weigh the benefits of the screening as opposed to the risk of getting the cancer.
Okay, maybe how do we treat someone with confirmed cancer of the cervix? How do you go about that?
So it's very important for the viewer to learn that when we perform a pap smear, we are not looking for cancer. We are looking for pre-cancer changes.
Okay.
So there's something that will tell us this person, maybe in another 5 years, will get cancer. By the time somebody has been diagnosed to have a problem, the treatment is very simple. Now, this person didn't go for screening, and after maybe those 5 years or 10 years, has now gotten the cancer. Now, we have to send somebody. If the cancer is diagnosed when it is small, somebody can benefit from surgery, where we remove the cancer.
Okay.
If it's big or it has started to spread, then only chemotherapy and radiotherapy.
Okay, so maybe what I can tell to my friends and to other women out there, it's that you have heard from the doctor, it's not that painful, but even if it is, it's better than to know yourself than to just wait and then suffer later on. So, if you ever had that it is very painful, yeah, it might be, but don't take that as a very bad thing. Just take yourself there for the screening and then you'll know about yourself. So now we're going to have a very short break, and then later when we come back, we're going to tackle on the breast cancer, and then we'll know what it entails, and then we'll have some more questions about this topic. And I hope you're having fun enjoying on this topic. So let's take a very short break. We'll be right back, so stay tuned. Did you know that Breast Cancer Awareness Month started on Thursday, 1st October and ends on Saturday, 31st this month? Mater Misericordia Hospital and the Sisters of Mercy have organized a free breast and cervical cancer screening on 18th October 2020 at the Well Karen, first floor, starting from 8 a.m. to 3 p.m. For more information, contact us on 0722 318 149 or visit our website www.matakenya.com. Breast Cancer Awareness Month. Mater Misericordia Hospital cares.
Kipaimara ni sakramenti yenye kumpa Mkristo Roho Mtakatifu na ukamilifu wa mapaji yake 7, kumfanya Mkristo mkamilifu na kumfanya shahidi hodari wa Yesu Kristo mpaka kufa.
Kupata kipaimara kama Skiza Tune yako, tuma neno Skiza likifuatwa na nambari 738100272 kwa 811. Jumamosi hii tarehe 10 Oktoba, shirika la wamisionari Oblati wa Immaculata watakuwa na sherehe ya upadirisho wa Shemasi Joseph Nzioka Chuli. Ibada ya misa itaanza saa 4 asubuhi, kiongozwa na mhashamu Askofu John Obala Oa, askofu wa jimbo Katoliki la Ngong. Sherehe hii utaipata moja kwa moja hapa Capuchin TV na kwa mitandao yetu ya kijamii kutoka St. Paul's Parish Kisaju katika jimbo la Ngong. Pongezi kwa Shemasi Joseph Nzioka kutoka hapa Capuchin TV.
Welcome back, dear viewer, and this is a topic of the Breast Cancer Awareness Month, and we are being joined by our Dr. Wanjohi. And before we went for a break, we have been tackling about what is cancer in general, and then we talked about cervical cancer, and now we're going to start another topic, and maybe some of the questions that we might be having before the end of the show, that is the parting shot. And so we're going to talk about what is cancer. What is a breast cancer? Maybe Dr. Ari, you can take it from there. What is a breast cancer, maybe according to you?
So from what we discussed before, is that we are making a lot of noise this month about 3 cancers specifically. Breast, cervix, and prostate for men. So breast cancer, it is now the cancer cell or the growth happening in the breast. It's very important for the viewer to know that the breast, even men have some breast tissue. And in fact, men, if they have a growth, then it's more likely to be cancer than for a lady. Because, for example, for a man's breast, they should not have any, they are vestigial, meaning they are not going to function, they have no function in the body. But for maybe a woman's breast, they are supposed to breastfeed a baby at some point. So finding that the breast is more active than, or having a small growth, then is less risky than for a man. For a man, there should be no growth. So that cancer cell forming in the breast is what is regarded as breast cancer.
Okay.
Yes.
And maybe can women who have just given birth, can they breast their kids, maybe if they are infected with the breast cancer?
So in general, there are some, just maybe aside from this topic a little bit, is that for cancer, we talked about risk factors.
Yeah.
But then we are yet to mention that there are some protective factors. So for protection against breast cancer, all women should know that they should breastfeed their children, and for 2 years that is what research has shown, that if a lady breastfeeds for 2 years, then the risk of cancer goes down.
Okay.
Still, that is, although it is a protective factor, it still means that that lady should still be aware that even when she's breastfeeding, she can still get the cancer forming.
Okay. Maybe you say, how common is it? Because I remember when we started on this topic or on this interview, you said that breast cancer, it's the second.
Yes.
Maybe starting one, it's the cervical that is mostly and highly infected. Maybe you can tell us how common it is and maybe the risk factor.
So, for breast cancer is number 2. Cervical cancer, number 1. Breast cancer, number 2. Now, who does this cancer affect? It affects especially women, but even men. So, men be aware. Now, the age is going to be a factor in this disease. So, the older somebody gets, the more the risk of cancer developing in the breast. So, another risk factor is things like diet.
Okay.
Now, having a diet which is very high in animal fat and with less vegetables in the diet, less fruits in the diet, then there's a risk of cancer developing. Now, number 3, obesity.
Oh, yeah.
Somebody should know their body mass index. Yes. Nowadays, we don't go by maybe the size of clothes which somebody is wearing or how they look in the mirror. We use the body mass index. So obesity is defined as somebody with a high body mass index above 35. So that means that person has obesity. So let's be aware. Another one is family history. So family history plays a big role in this disease. We even have a prominent maybe movie personality who actually had both her breasts to be removed because she has a very strong family history of cancer of the breast. So that person just decided, I'll just go to the hospital, they removed my breast tissue so that now my risk of cancer is 0. So this is a real disease, and now you hear somebody like that is still alive and is well, but somebody else maybe in a Kenyan village will have both their breasts with a strong family history of cancer, and then will get cancer of the breast, and then we lose them.
So maybe it's not a matter of, people think that if you have cancer or the breast cancer, you're not likely to live, maybe we say even maybe 5 years. People believe you might die. I know it might cost someone, the charges are very high, traveling and going to get maybe medication. But what do you think? How long can one live even if you're, infected with the breast cancer?
So that's a very important question, because most people think cancer is like the way you say, I don't know if it's a death sentence or a life sentence. I'm not too sure which is which.
It's
a death sentence. However, let's look like, even if we Google on our phones, there are so many people who have survived cancer. It's just a disease like any other, provided we catch it early and treat very early.
Okay.
Yes, so all women should know that if we catch this thing early, then we can offer treatment which can help the lady to prolong her life. In fact, when we are saying that, once someone has stayed 5 years without cancer coming back in the body, maybe they had cancer of the breast, then they've undergone the treatment, and then after 5 years, there's still no cancer cell in the body, we say that person has gone in remission or has been cured of that cancer. So it's very important for ladies to know that. Okay,
maybe you can tell us, how do we go about the screening for the cervical, for the breast cancer, sorry?
Okay, so for screening for breast cancer is something that even the viewer can do at home. Remember, even men, even ladies should screen themselves. So
the self-examination.
The self-breast examination. So what somebody should do is somebody either to stand in front of a mirror.
Maybe you can try look at the camera and maybe you can show, you
Okay.
can tell to them maybe,
Okay.
yeah, this camera.
So somebody should look at themselves in the mirror with their clothes up to the waist and to compare both breasts. They are going to compare in 3 positions. So when the hands are down, when the hands are akimbo, and when the hands are up. So when the hands are down, they are going to check the breast if there's any asymmetry. Maybe one is very down and the other one is very up. That is not very normal. Now, if maybe one is swollen and the other one is back there, so that is not normal. So check the symmetry. They should look similar. Now, number 2, when you put the arms akimbo, the breast tissue, if there's a lump which is hiding in the breast, it will come out. Now, number 3 is with the arms up, the breast tissue originates from the armpit. So the armpit is a good place also to check if there are any lumps. Now, that is just looking. Okay. Now, next comes touch. So we are using 2 senses, the sight and the touch. So somebody lies in the bed. Somebody lies in the bed or still in front of the mirror. They put the hand behind the head. I hope whoever is watching this is also following what we are doing in your privacy at home. So you divide the breast into 4 quarters. So you draw a cross on the breast with the nipple at the center. So this upper quadrant is where 60% of cancer of the breast in ladies begins. So that is where to spend most of the time. So by putting the hand on the breast, somebody, you can see there I put my hand, not like this, but like this. Somebody presses and goes round to feel what they can feel, if there are any lumps. Then next this quarter, next here, and then followed by here. Finally, they press the nipple and areola to check if there's any discharge. Sometimes you can find blood, we can find pus, or even milk. If somebody is breastfeeding and they check and they find milk, that is okay because we expect them to have milk. And then they follow with this side. Now, if somebody has a problem in the breast, then they seek services of a health professional to also confirm before they go and jump to conclusions that now because this one I'm feeling funny, then I have cancer. No, that is not the case. They go to hospital for screening. That is the benefit of screening, and that is the benefit of this month.
And maybe the good thing about self-examination, it's good
Yes.
that I hope everyone have been following about that and you have been trying to do every step that he has been showing us. And so maybe you can tell us, how do we treat cancer of the breast?
So in terms of treatment, for all cancers is fairly standard. If the cancer is small, then we can remove. We can either remove the cancer locally, like just remove only the cancer cells, but that is not very common in Kenya. In Kenya, what we advocate is to remove the whole breast. Once we remove the whole breast, then we know there's no more tissue which can become cancerous. So that is one, if the cancer is small. If the cancer is big, maybe it has spread to the lungs, to the brain, to the liver, to the intestines. So this person then needs radiotherapy and chemotherapy. These ones are being offered at various hospitals, even with the government, even with the private. It's very important for people to know.
Okay, maybe some of the questions, because people say that women are not supposed to wear bras maybe for longer than 8 hours. It may cause breast cancer. And also another thing, they say you're not supposed to sleep with a bra. And then you're not supposed to put on tight bra. Is it true it might maybe expose you to having breast cancer?
So that's a good question, because that's a myth which has been going around. It is actually not true.
Okay.
Yes, what happens if somebody wears a very tight bra, they'll only feel discomfort and pain, but they will not get cancer as a result of that. So somebody should wear maybe the clothes which are fitting to them, so that they don't have also other unwanted side effects, such as maybe a lot of pain or a lot of discomfort.
Okay.
About sleeping with a bra, it's true. We don't advise somebody to sleep with a bra because it's also uncomfortable to them, like the breathing system and their sleep.
Okay. And maybe we can talk about the warming food on the microwave. Many people say that microwave and maybe warming food with a plastic thing or maybe plate can cause cancer.
So that is
Is it a myth or is it true?
so it's a myth in one side. So there's the actual fact of taking your food, put it on a plate and put in the microwave. Then switching on the microwave. That one cannot make the food to cause somebody cancer. But heating food using a plastic container, what happens is the plastic begins to melt, and then it catches the food. Now that plastic, if it is ingested, it is one of the risk factors, a dietary risk factor. For example, there are those people who eat nyama choma. It's put in a plastic paper, and then it's put to warm on top of the fire. Now that is it can eventually cause cancer, for example, colorectal cancer.
Okay, and also smoking and taking alcohol.
Yes, smoking and taking alcohol, those are modifiable risk factors, which all people should be aware. They stop.
Okay, I know we cannot be able to exhaust about this topic, but on the last take, you can tell us what is the purpose of having this October month as a breast cancer awareness.
Okay, so to all viewers, no, we are making a lot of noise about 3 cancers: cancer of the breast, cancer of the cervix, and cancer of the prostate for men. So we want people to go and get screened. Now, Capuchin TV is located very near the Well Mall, which is in Karen. There's a Mata branch. So we are going to be having screening on the 18th of this month of October, and it will be very subsidized for all tests which we are going to do for somebody. Breast cancer screening, in fact, it will be free because we only just do that examination with the patient. For cervical cancer, it will be very discounted. For the ones who qualify, they'll need mammogram or breast ultrasound. These are going to be also subsidized so much for the patients. So all patients to know, or all, actually this is to the general public, to go and call their shoshos and their moms and their aunties, wherever they are, come for screening, come for screening, come for screening.
Sure.
Matter the Well is the place for you.
Okay, thank you so much. I know we have not been able to exhaust, maybe we haven't even answered all of your questions, and hoping that you're going to come back again to, we can talk more and more about this cancer.
I'm really
and
looking
making
forward.
people aware about this cancer. And I hope you're going to show yourself, go for the screening on 18th October. Don't be left outside. So make sure you call your friends out, your mom, your relatives, your bestie. Tag them along, please. And so I have enjoyed this topic. Thank you for coming.
Thank you very much.
It was a pleasure meeting you.
Yes, you have been a great host also. Thank you.
Thank you so much. And I have been able also to learn a lot on this. Many things I never knew, and the myths. I hope you have taken notes about this. Thank you for joining us. It was a pleasure. Thank you. And I hope you're going to have a very good day full of blessing, and may God bless you. I am Maureen Kimani, and my guest has been
Dr. Victor Wanjohi.
Okay, see you next time. God bless.
God bless.
Did you know that Breast Cancer Awareness Month started on Thursday, 1st October and ends on Saturday, 31st this month? Mater Misericordia Hospital and the Sisters of Mercy have organized a free breast and cervical cancer screening on 18th October 2020 at the Well Karen, first floor, starting from 8 a.m. to 3 p.m. For more information, contact us on 0722 318 149 or visit our website www.matakenya.com. Breast Cancer Awareness Month. Mater Misericordia Hospital cares.